Hello, I'm Emma Howard and I'm joined by Dr. Jonty Heaversedge, who's an expert on men's health problems. Hello, Jonty.
Hi, Emma.
Got a question here from a young man. Just over a month ago, I tore my frenulum during sex. I know you'll explain to us exactly what that is in a moment. Now, he thought that it would heal on its own, but it hasn't, so clearly he's very sore. And he's read on the internet that I might have to have a frenuloplasty.
Frenuloplasty, yeah.
Frenuloplasty, easy for you to say. And he wants to know what this would entail. But for all of us, just explain what the frenulum is.
So the frenulum, now I can't say it, the frenulum is the little piece of skin that attaches the foreskin to just underneath the head of the penis, underneath the glands of the penis. It's actually not an uncommon thing to injure, particularly if the foreskin's a little bit tight, which for some men it is. It's not uncommon just to tear that little piece of skin during sexual intercourse.
So that would be very sore, wouldn't it?
It's sore and it often bleeds a lot, so it's pretty terrifying when it happens. But the good news is that actually for the most part it does heal up all on its own. Normally I just suggest to people you keep the area clean and you do need to abstain from sexual intercourse for a month or so afterwards, and it should heal up. Now in this chap's case it's not healing, which is a bit unusual, and I suppose any wound that doesn't heal, I always think about infection. So I think what he really ought to do is go along and see his doctor and just check. It may be that he needs some antibiotics or an antibacterial cream in case there's an infection there that's stopping it from healing up.
He's been reading about a frenuloplasty. What would that entail?
Yeah, that is more for people. Sometimes when the frenulum heals up you get quite a lot of scar tissue, and that makes it tighter and shorter, which actually means it's more prone to tearing in future. So what you can have is a frenuloplasty, which is an operation that actually, by putting a small incision under local anaesthetic, will lengthen the frenulum and make it less likely to happen in the future. So if you've got a lot of scarring, then it's something that it's worth talking to your doctor about.
But he sounds as if he's at the first stage, which is he's torn it and it just hasn't healed. So he needs to just get it checked out.
And
would you bathe it in salt water, just the kind of normal procedure for any bit of skin that's still not healed up?
For any wound that's not healing up, salt water bathing is ideal. Yeah.
Okay, thank you very much. Good advice as always. If you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.